How's it been going?
Pretty good. How are you?
Good. So, since last session, I always kind of want to start off this way. Do you have any questions or anything you want to address before we kind of get going?
I just kind of want to know what we're gonna do today and go from there, I guess.
Okay. So, remember last session we were talking about your anxiety with the assault that you had with the gun in the Walmart?
Yeah.
So, with that, when we were talking about that, you were telling me about your anxiety symptoms. So, you were talking about how you're getting kind of heightened heart rate. You kind of feel like you're overthinking and doing a lot of what if statements since then, kind of feeling like someone's always watching you or someone's around you all the time, stuff like that. Does that ring a bell?
Yeah, absolutely. I've had quite a bit of that lately.
So the reason why I didn't really address coping last session is because we needed to make sure that we knew what your reactions are. So what I was kind of hoping that we were going with today, unless you had a different direction we needed to take, was kind of anchoring off of your anxiety from what you experienced last week to try to go on a more coping side for this week.
That sounds good because I'm ready to learn some coping skills to kind of figure this out.
Got you. So you remember when you said that you overthink, right?
Yeah.
You do the what ifs. And you told me last week that you kind of felt like that was the first thing that happened when your anxiety started to kick in.
Right.
So the order you gave me was overthinking, then what ifs, then you kind of had body responses on your heart rate and then shaking a little bit. So the reason why I go into that is because it's really important to know where your anxiety starts before I teach you coping mechanisms. Because if I taught you coping, you wouldn't necessarily know when to use them if we didn't know when your anxiety started. If
Yeah.
that makes sense.
Yeah, that makes sense because like it's like I don't even realize it sometimes when I do start overthinking and then um it just goes from there. So I'm interested to know when I need to do what.
Got you. Okay. So we're going to go a little bit into psychoeducation with all this. So, first, when you think about overthinking as your first warning sign for anxiety, this is when you would start using your coping strategies because that would be your, oh, wait, I see myself doing warning signs and overthinking and stuff. That means I need to do something. So, what that something is we have a couple of variety of techniques that are available to you. So it might seem like I'm kind of giving you a lot, but the reason behind that is because I want you to kind of pick some and see what works best for you because everyone's different. So we'll start with the meditation one first. Have you ever heard of meditation?
Yeah, I've tried it before.
Okay, cool. So with meditation, you kind of get the basic thing where you just kind of sit there and it's going to be silent, and then it kind of has you focus in. So the meditation that I'm kind of thinking that would be best for you in regards to anxiety is an app called Headspace. So what this essentially does is it's going to be like a moderated one, and because you have acute stress disorder, because you said your assailant was a guy, it might be easier for you to use the female voice on there. So if you're feeling triggered at all, if you want to use that technique, I would recommend the female voice opposed to the male one. So you can pick from like 5 minutes, 10 minutes, 15 minutes, and basically it just kind of has you go through it and shows you what to do. So that would be what meditation would be, and that might help you whenever you're anxious or when if you have trouble sleeping or something like that, that would help you kind of reset your mind so where you can relax. Does that make sense?
Yeah, and I like how you said to use the female voice too.
Yeah, because that can really be triggering and make meditation a little hard if you use one that's going to trigger you.
Right.
So the second technique would be grounding. Have you ever heard of grounding before?
No, what's that?
So it's essentially kind of putting you where you are, if that makes sense. So the grounding technique that I've had a lot of success with clients is called the 5-4-3-2-1 method. So essentially what this is you go through all of the different senses, so your five senses, and you would do, for example, what are 5 things that I can see? What are 4 things that I can touch? maybe 3 things I can hear, 2 things I can smell, and 1 thing I can taste. So it doesn't matter what order you go into. It's just going to matter that it refocuses your mind, is how it works.
Okay.
So that one would be what grounding would look like. And then the last technique would be kind of a breathing exercise. So this you can use with a partner or you can use it with yourself. But essentially what you're going to do is you're going to stick your finger out like that and hold on to it. So when you hold on to it, you're going to breathe in when you put pressure on and then breathe out without pressure. So it works a little better if you have a partner because the partner will deep breathe. So for example, if someone's holding it, the other person would go, and then you would start doing that because you're going to imitate them. So that one does work a little better if you have someone with you who's going to be able to help you do that. So
Okay.
is there any one of those 3 that kind of sounds like it would be a best fit for you?
Whenever I think about the grounding technique of 5, 4, 3, 2, 1, I
Mhm.
feel like I'm pretty in tune with my senses already, so I think that would help me.
Got you, to kind of refocus you in.
Yeah.
Okay, so let's go through one of the phases of 5, 4, 3, 2, 1 so you can get some practice. So
Okay.
say you're starting to overthink. What are you going to do?
So I will recognize that that's the time that I need to start using a coping skill, and then I'll, decide if I want to try meditation, do the 5, 4, 3, 2, 1, or the exercise with holding your fingers with a partner. And then if I choose the 5, 4, 3, 2, 1, I'll think about 5 things that I can see, and I'll name them out loud if I'm in a place that I feel comfortable doing that. Otherwise, I'll just kind of think them. And then I'll go to 4, which is like 4 things that I can touch. And I'll probably have like my pen, my notebook in front of me. I'll have probably a sweater on. It's kind of chilly, so I'll touch each of these, and then maybe my coffee. Maybe I'll pick up my coffee because I can feel that it's warm, and then I'll go into like 3 things that I can smell. Um, Maybe go into like the kitchen and or maybe I'll smell my coffee. Maybe go to the kitchen and maybe pick up a fruit, maybe an orange, and smell that, and then maybe smell my perfume from the morning on my wrist, see if I can still smell that. And then what are the other 2?
The other ones would be like taste. So it's something that you could taste.
Okay, so definitely my coffee.
Yeah, you could definitely taste the coffee.
Yeah, and then I'll have and then probably I'll try to think of like, okay, I probably need water too, so I'll probably have some water and see how that tastes, even though it doesn't have much taste.
You did
Um,
smell too, right? Because smell would be another one.
I did smell, sight, feel, taste,
Touch?
touch, and I did touch too.
Yeah. See, this is how it works. You kind of get confused even trying to go through it, that now you're thinking about something else. So that's good. That's exactly what grounding is supposed to be doing. It's kind of refocusing that. So that was really good. So that looks like it would be a good technique for you to use, and it did seem to distract you and kind of get your mind focused on something else.
Definitely, I like that one.
Yeah. So one other thing I wanted to talk to you about that is kind of another use for coping would be medication. So you've been kind of struggling through this for a couple months now, and your anxiety, from what you reported, is pretty high. And even before that, it was still high. So with that, have you ever thought of medication as an option for you?
I've tried it in the past, and it seemed to help, but I haven't really thought of it for now.
Got you. Is it something you're wanting to try or something you're like, I think I'm good?
I think it's definitely an option if I use these coping skills consistently, and then if I'm still having the same like amount of trouble.
Mhm.
Um,
Yeah, 'cause with anxiety and things like that, it kind of gets hard. Sometimes when we're going through like something that's kind of traumatic like that, and we already had really high anxiety before, anxiety can be used to kind of get you over that little bump so that the coping mechanisms are able to work. So if you kind of find yourself struggling using the coping mechanisms, medication can help even you out where you can practice those coping mechanisms and wean yourself off the medication with a provider. So that way
mhm.
you're a little more solidified if coping isn't just helping.
Yeah, I think that might be an option. Um, but I'm excited to try these coping skills to see if they help first.
Yeah. And another thing that I forgot is some people like aromatherapy with the grounding technique too. Because when you talk about smells, it's kind of hard if you're at work and you're trying to think of like three things you can smell. But aromatherapy for some people works out. So if you get like an essential oil that you like, you can put it on your like wrist or on a piece of jewelry, and that could be one of your scents too. That helps you ground.
I actually have some essential oils, and I have a little clay. Um, I don't know what it's called, but it's just a little clay design, and it's on a string hanging in my office. And I did put orange essential oil on it, but that's been a long time ago, so I haven't thought of it until you said that. So it's
Yeah,
lost its smell.
probably if it's been a little bit. But that's also something that's useful when it comes to grounding because sometimes that can be a useful tool with the grounding as well. Especially because I know when I've had some people use the grounding technique, they kind of get stuck on smell because then you're like, what is this? Or taste. If they end up doing taste as their like two, it's kind of hard to taste two different things.
Right. Yeah, and one of the things that I like about that though is like it makes me think, well, have I had anything to eat?
Hmm.
So, maybe having a snack at that time, and that might actually help me too.
Yeah, it could be a reminder too, because sometimes when we're anxious, we kind of forget to take care of ourselves. So that would be a really good thing saying, hey, it's lunchtime and I didn't eat anything. I probably need to do that. Like that's pretty important to my day to be able to function.
Yeah, definitely.
Yeah, that's a really good thing to be able to notice too.
Hmm.
But I'm really glad that you ended up finding a coping mechanism that worked for you. And that being said, though, you still have my number. So if you're having any issues with like severe panic attacks or anything like that, and it's not working, I can also be a reminder tool for you if you give me a text if it's getting bad, and I can be like, okay, what's your 5 4 3 2 1? And you can use that with people too. Like if you have trusted coworkers or like a friend or family, you can have them be like, if they see you getting panicked, you can be like, hey, just so you know, if I start getting panicked, I need you to tell me 5 4 3 2 1 so it reminds me to do it.
That's a good idea. I hadn't thought about sharing that with someone.
It's really nice if you do have close family because then it helps them get involved so that they feel like they're also being able to help, but it doesn't make you rely on them to help with your anxiety because sometimes I have clients that come in who have others kind of be their, I guess, their crutch with it. But in
Hmm.
order for you to kind of be able to manage your anxiety, it's really important for you to be able to identify these things so that you can handle it, if
Yeah,
that makes sense. 'Cause
definitely. It does.
that's going to make a lot bigger impact in you being able to manage this and work through the trauma from your event too.
Yeah, that definitely makes sense.
So, kind of while we're thinking about wrapping up a little bit, is there anything that kind of happened this week that's kind of on your mind that you wanted to address?
I've had a lot of the what if statements, like, what if I go to Walmart and it happens again? What if I go anywhere? Um, and if something like that happens, and then it just automatically goes into shaking. So,
Yeah, and that's definitely really hard. And with that, that's a perfect example of what you can do with the coping mechanisms to try to help you manage that. And even like the buddy system, if you do have to go to Walmart, you can have someone go with you to kind of make you feel a little comfortable so that you're able to go there and feel like you can shop and feel safe. Or maybe you start shopping at Target because you're not ready to start shopping at Walmart again since it's still pretty fresh.
Yeah, I like the idea of the buddy system too, and I think that that would help with like social support.
Yeah, it definitely would. Okay, that's my 15.
Okay. Um, all right. So it's good to see you again. Thank you for coming in today.
Yeah, you too.
So if it's okay with you, we're going to have an educational session today about your next steps that you're going to be taking with me here at Center for Behavioral Health. I want to offer you some information about the program and about what treatment and interventions that you will be having while you're here. Does that sound okay?
Yeah.
Okay. So when you first came in, we did the biopsychosocial, which was the 111 questions that we went through that took quite a while. And so what that was able to determine for us was that you definitely have an opioid use disorder. So within that, there are two separate assessments that we used, and I just wanted to educate you about those. So one was the Diagnostic and Statistic Manual, Edition 5, Substance Use Disorder Diagnostic Criteria. And it sounds like if you've never heard of it before, it sounds a little complicated. But basically, that was the section that I just asked you, I think 10 or 11 or 12 questions. And then we were able to determine your substance use disorder. And then the other assessment within that was the American Society of Addiction Medicine criteria. And so we always use those together to confirm that the people who come here are in the right place. So that's the most standard. Those two used together are used in the field of social work and substance use counseling to determine and confirm substance use disorders. So I just wanted to let you know that's pretty standard. Do you have any questions about that?
Um, I guess how is it determined like on my score compared to other people that I have an issue?
So if you answer any more than I believe it's 4, I think it's either 4 to 6 on the DSM-5 substance use disorder diagnostic criteria. That shows that you have a severe substance use disorder. If you answered like 1 or 2, that would be mild. If you answered 0, of course, that would show that you don't have a disorder. Does that make sense?
And I was on what stage again?
So you have a severe opioid use disorder. You answered 6 questions that determined the severity of your disorder. So those were questions like, did you have withdrawal symptoms when you stopped using? Another question was, did you have to use more in order to feel the same effect? So I just wanted to kind of let you know that that's pretty standard for what we hear. So do you have any questions about that?
I guess not. I guess I'm just a little surprised. I didn't really think, it's kind of hard to realize that, it kind of hits in. So I always
Yeah,
knew it was an issue. I didn't know it was like that much of an issue.
yeah. And, whenever people come here, they generally know that they need help, but sometimes it's hard to see that it is that much of an issue. And I'm really glad that you're here, and you are. This tells us that you are in the right spot for the treatment that you need, and to succeed in your goals of not using anymore. Um,
When you talk about treatment, what does that mean?
So that's actually another part of the education that I wanted to get into. I'm glad you asked. So a little about the program and interventions is that so the treatment we offer is most fitting for opioid use disorders. It's a evidence-based approach to address your specific problem of opioid use disorder. Here at Center for Behavioral Health, we offer OTP, which is it's an opioid treatment program. More specifically, we offer MMT, which is methadone maintenance therapy. So as you know, you've been in the program for a week and you've been drinking the methadone each day, and each day they're increasing your dose, and with that, you'll feel less and less of the cravings for opioids, and your withdrawal symptoms will eventually subside. So with that, we offer that in combination with psychoeducational counseling. And what that means is you have either one-on-one sessions with me, just like today, or you go to weekly group sessions. And so with those group sessions, it's also psychoeducational. And what that basically means is you'll learn about stress management techniques. You'll learn to recognize triggers. You'll learn about how to avoid people, places, and things, and identifying those that trigger you most. And you'll build things like relapse prevention plans for yourself and with your counselor. So do you have any question about that?
So, am I going to be on methadone for like ever or?
Each person is individual, and it really depends. There are some people who take methadone for a year, and in probably best case scenario, they will reach a point of a stable dose after they've been here for a month or two. And then with best case scenario, what would happen is we would use different strategies and treatment plan goals to discontinue use of your illicit opioid use, and then work on relapse prevention planning. And then eventually you could taper from the program, and then we would offer up to 1 year free counseling services after that to make sure that you have a follow-up plan, relapse prevention plan. Now, on the other hand, some people take methadone, like I guess on the opposite end of the spectrum. Some people will be on methadone for the rest of their lives, and most of them are okay with that, at least here in our program. It's something that it offers a better way of life for people who have opioid use disorders. So within that too, just a little bit more about the program and interventions. Part of that MMT, or methadone maintenance therapy, is daily dosing to make sure that you reach a stable dose, and also so that the medicine builds in your system, and you're able to conquer those withdrawal symptoms and cravings so that you eventually stop using illicit opioids. And within that too, if you have daily dosing and you come to all of your sessions, you are offered incentives such as our take-home phases, or take-home doses within phases. And with those, that means that you come daily, you attend all of your appointments or group sessions, you don't have any criminal justice involvement in the last 6 months, and you abide by all of the other program rules. Do you have any questions about that?
Do I have to do counseling? Like, is that something that's really needed for treatment?
That's a really good question. There are programs out there that you don't have to do counseling. However, here at Center for Behavioral Health, we want to let you know that it is a very important part of your treatment here. So each week we will need to meet for at least 15 minutes. However, I give you up to an hour if you're going through a lot. I generally have about 30-minute sessions, and I'm very flexible. If you have something going on, you have a job interview, I have a pretty open schedule to be able to reschedule, and I work with you and meet you where you are each week even.
So is this like a residential program?
So this is an outpatient program. So you'll be coming and going every day. And I like to have a set session with my patients, so that we can just keep up with it better. If we meet on Wednesdays at 6 a.m. every Wednesday, that's just a lot easier than trying to have a session on a Monday and then on a Friday and then on a Wednesday. So, um,
So I'd be doing the methadone every day, and then I would be doing the counseling once a week.
yes, that's right. Um, and with that, I really want to help you work towards your treatment plan goals. We had went over your treatment plan last week, and you know, we worked together and collaborated on that. And so one of the most effective treatments for opioid use disorders um, is the MAT, sorry, the medicated assisted treatment combined with counseling. So studies have shown that people who attend counseling along with MAT have better outcomes for long-term recovery. So it's actually extremely beneficial for you to attend both. Um, so does that make you feel comfortable and more in control of your treatment here so far?
I mean, I guess so, but like, what about my kids?
So we'll definitely work on reaching the goal of obtaining custody again of your kids. Um, you know, as it's difficult for you to completely stop using illicit substances. So as you build your dose, we'll work through the withdrawal symptoms. We'll work through the cravings, and we'll plan relapse prevention plans. And while we're doing this, we're going to be using a few different strategies to be able to reach those goals and ultimately, petition to get your kids back. With these interventions, a few of them, I want to let you know they are evidence-based. So they're proven to work with substance use disorders. And so the first one is strengths perspective. And you can kind of get a sense of what that is just by, it's kind of common sense, like looking at your strengths. So, you have social supports of your mom and your sister. That's wonderful. So that's one of the things we'll pull from in future sessions. Another strategy and intervention that we're going to use is called motivational interviewing. And basically, with that, I'm going to be asking you a lot of questions. And then when you respond, I might ask you more questions. And you can kind of let me know, like, on days that you kind of just want to be heard and not ask questions, and I'm totally flexible with that too. And then the last one that I will incorporate, we'll work together with each of these, is cognitive behavioral therapy. And it sounds a little complicated, but it's basically to help you improve your mental health by challenging negative thoughts and kind of identifying those negative thoughts and challenging them and maybe replacing them with more positive thoughts. So do those sound okay to you?
Yeah, I don't know. I just kind of wish there was an opportunity for my kids to be able to understand.
And that, you know, that's something that's really close to your heart. And you know, if that's something that you want to work on, we can put that in your treatment plan. You know, perhaps you can work on writing them a letter, either individually or together, to each of them or individually. And so we could work through stages of that letter, what you might want to tell them, what you might not want to tell them right now. And I think that could help you. That process of kind of going through different drafts of that could be beneficial to work out what you really want to be able to offer them when you do have the chance to get them back. Does that
So,
sound all right?
yeah, but then you were saying that there's like you guys would help me get my kids back. Is this like case management too, or?
So this is more focused on your opioid use disorder. However, it has an element of case management to where, you know, if you went to court, we would offer a confirmation of letter treatment. You would sign a release of information, and you know, we would only release exactly what you wanted to the courts. We wouldn't offer any other information. Um, and that way you would be in total control of that.
Okay.
All right, thank you so much.